Any smoked cocaine product will produce a more intense effect than snorted cocaine. So the amphetamines are actually a little bit stronger. This is true even though most of the cocaine product is lost in the air, about 75% in a pipe and 50% in a cigarette. Usually you lose most of the cocaine. Hence, more cocaine has to be smoked to get a strong effect, so it's kind of a waste. We need to do this properly. If you really want to use cocaine, go ahead and snort it, because at least you get all of it, most of it. And what you don't get, you can wipe off with your finger and put in your mouth. Even when cocaine is smoked or injected, the drug is metabolized rapidly. It only lasts for about 15 to 20 minutes, and it must be renewed for a stronger effect. Now the problem is, of course, you get this intense effect, and it only lasts for 15 or 20 minutes. Now we got a problem because we need it again. And you have things happen to you after it goes away. The more you snort, of course, the less of a buzz you get. The amount of time you get as a good buzz goes dissipates. It decreases. Crack gives a rush that only lasts a few seconds, and a euphoria and excitation that only lasts a few minutes, between 5 and 20. And like I said, it all depends on how much you've used as to how long it's going to last this time. As soon as the effect dissipates, the individual feels irritable, dysphoric, they're irritated, they're uneasy, and anxious. So you get anxiety attacks. For this reason, crack is almost always smoked in a binge pattern. They just smoke it all up. You don't share with your friends. This doesn't feel good. This really doesn't feel good. So it's not like you're going to share it with your friends. You might sell it to your friends, but you're not going to share it with your friends. Crack does have some fairly unpleasant side effects. It makes you thirsty, it makes you cough, it gives you tremors. They're kind of fun people because they can't hold still. They can't hold still anyway, but then they get these tremor things going. You saw that, I showed the film, the video of the guy just bouncing all over the place. He just couldn't stand still.
Crack dance.
Crack dancing, yes. Sounds like break dancing. Dry skin is always attractive. Slurred speech. Dried skin also has to do with the formication. Remember, they scratch themselves a lot because it feels like they've got bugs crawling all over them. Well, they actually do have dry skin, so they do tend to scratch themselves a lot, either from formication or from the dried skin. It forces them to have slurred speech. It messes up their vision. Crack keratitis is abrasion of the eye because the crack pipes, if you've ever seen a crack pipe, they're really short. So they're right here, right in your face, and they're lighting this thing, and the hot gas gets into their eyes, and it burns their eyes. It cooks their eyes. They get crack thumb from flipping the lighter. I know this all sounds so stupid. That burns their hands, and they get the callus on their thumb from lighting their pipe all the time. So they're really kind of cool people. I mean, if you see somebody who does this all the time, their thumb will be yellow because of all the smoke, but they'll also have a callus on the side of their thumb from lighting their crack pipe all the time. No, they may have burns anywhere. I mean, usually it's in their face because they're lighting the crack pipe. The pain doesn't bother them while they're high. It bothers them afterwards, of course, but it doesn't bother them when they're high. So they cook their faces. So they have a burn spot here and a burn. They'll lose an eyebrow, stuff like that. And they just do it. Psychological side effects of smoking crack, paranoia, craving for the drug, of course, asocial behavior. This is a little bit different from other drugs. I mean, people who smoke pot, say that the reason they do it is because it makes them feel close to other individuals. These individuals don't want to have anything to do with anybody else. They are totally asocial. So if you have a friend that all of a sudden disappears, starts losing weight, and every time you see them, they're really kind of grouchy. They don't trust anybody. Potentially, they're a crackhead. So you need to be careful of that. You need to stay away from these guys because there's some negative things that can happen. They not only get paranoid, but they also get violent. So these are the people to stay away from. If you've got a relative like this, don't go to their house. Try to talk them out of whatever's going on. They have attention problems. It's really kind of cool. Well, I don't know if it's cool, but they can only think in one direction at a time. So you have to be really careful as to changing subjects on them because it really pisses them off. So you can only talk about one thing at a time, and you have to follow that line of thought to a certain point, and then you can say, I think we need to change the subject now. Let's start talking about this. And then they can shift gears and turn onto another road, and so that they can start thinking about whatever it is you're talking about. But if you bounce all over the place with your conversation, they're not going to be able to follow it. They're irritable. They have what they refer to as drug dreams. Some of these are good dreams. Most of them are bad. They have to do with monsters and being eaten by monsters. Hyperexcitability, visual and auditory hallucinations. Remember those monsters I was talking about earlier? Depression, of course, because they are so high when they're on the crack. Cocaine psychosis, of course, high risk sexual behavior. Remember, they can only go in one direction. They can only think in one direction at a time. So they really have a difficult time with this. This is one of the reasons why. Oh, wait a minute. Something happened last night. I was watching the news. A guy was accused in Albuquerque of prostituting his 7-year-old daughter for drug use. I know they showed him and it was a white guy. That's like the first time a white guy's ever committed a crime in Albuquerque and got his picture on the news. It was kind of exciting. Well, actually, there were 2 white guys that did stuff. Another guy was wandering all over the Southwest, killing and robbing people, robbing and killing people, and he was a white guy too. I think he had a really heavy beard. Really kind of hard to say. Respiratory side effects from smoking crack: chest pains, pneumonia, coughs. They cough a lot. It's really kind of interesting. They get what they refer to as crack lung, where they can't really get rid of the CO2 in their lungs. They cough, but it's a superficial cough. It's not a deep cough. It's not like it comes from the bottom of your lungs where you're trying to clear everything out. That's not the type of coughing that they do. It's kind of a thing. It's just like on the surface, and so they can't really get anything out. Hemorrhaging, they will hemorrhage into their lungs, so they'll spit up blood, which is always a lot of fun. Respiratory failure is another problem. Death is usually due to anesthetization of the respiratory center in the medulla, and for that reason they do die. For the longest time we thought that crack was not, or not, well, crack and crack cocaine. Cocaine was not addictive, but now we know, of course, that it is quite addictive and it does cause death. One of the drugs that doesn't cause death is marijuana, another one is LSD, but cocaine does cause death. Crack or freebase can be mixed with marijuana to create what we refer to, or what they refer to as caviar, champagne, Grimmies, I haven't figured that one out yet, Fry Daddies, Cocoa Puffs, Hubba, and Woolies. That's where you mix cocaine with marijuana. Users may combine crack with PCP or ketamine to make space basing, whack, or tragic magic. Mixing crack with tar heroin creates speedballs, hot rocks, or Belushi rocks. This is what John Belushi overdosed on, was a speedball. They gave him a shot of cocaine and heroin. The idea being that the two would work against each other, but it's not that way. You get a synergistic effect. and it shut down his respiratory system, and he died. It was his girlfriend that injected him, evidently. And of course, Chris Farley died exactly the same way. Speedballing. When crack or cocaine is mixed with wine, it's called crack coolers. Sounds cool. In 2004, 4,500 deaths occurred from the direct or indirect effects of cocaine. Between 1997 and 2017, 72,000 people overdosed in the United States. 72,000. Most of them were last year. 42,000 people died last year of overdoses. So this is our continuing and really serious problem. Cocaine overdose doesn't always kill, but results in tachycardia and hyperventilation, accompanied by a feeling of impending death. Usually the impending death is because you can't catch your breath. What they need to do is breathe into a paper bag, but thinking is not one of the strong suits. Remember, one of the things that happens is this stuff destroys your brain cells. So being intelligent is not one of the side effects of cocaine usage. Tachycardia, of course, has to do with your rapid heartbeat. Death usually results from cardiac arrest, seizure, stroke, respiratory failure, or hyperthermia. So their temperature goes up mainly because they're breathing so hard. And of course, that increases the temperature in your body, and they'll die of hyperthermia. Social consequences, because using crack can lead to risky sexual behavior. Children are sometimes produced in circumstances that are not optimum, of course. If you've got a crack mom, then she's not going to take care of the kid. Potentially, she's going to sell the kid. Remember, they can only think in one direction at a time. So if you've got a child here and you've got a desire to use, which one takes precedent over the other? And the answer is wanting to use. And this is one of the reasons why, especially with methamphetamines and amphetamines and cocaine, we find a lot of people that prostitute their children because, well, all they want is the next fix. And the kids, of course, are a commodity that they utilize. What were they talking about, the little girl? Oh, yeah, last night. Evidently, this guy's been prostituting this little girl since she was in kindergarten. She started wearing high heels and putting on makeup. This was in kindergarten. They had turned him in because of the little girl, all this inappropriate behavior at school when she was in the first and second grade in kindergarten. Really kind of ugly stuff. So this guy had been doing this for an extended length of time. In his case, the mother had taken off. She was gone, and he was using the child as a commodity. And that's how he was getting his stuff, is by selling his child. Crack smokers have social problems, and they don't relate to their own offspring any better than they do to anybody. And they, of course, can't get along with anybody. These are people that are focused inward. They're not focused outward. So they don't want to make friends. They're not there to make friends. They're there to get high. So interacting with their children is not something that's important to them. Crack smokers show high rates of neglect, abandonment, and abuse of their children. There are high rates of single and no-parent families. Women willing to trade sex for crack are very common, and then it starts all over again. She gets knocked up again, and I was just reading an article about a lady that had 3 children, and she sold all of her children, all 3 of her children. She allowed her husband to rape her daughter when she was 10, and then they took her off to a convent. It was a really ugly story. The physical and mental effects of cocaine and amphetamines are similar. Cocaine is about twice as expensive as amphetamines, but it's a better high, of course. Cocaine gives a greater rush and more intense high than amphetamines, but amphetamines allow for more prolonged energy. Amphetamines' effect lasts for 6 to 9 times longer than cocaine, so you get a better buzz. Amphetamines are more likely to cause addiction than cocaine. Amphetamines are synthetic stimulants that provide similar effects as cocaine, but cheaper and more prolonged. Amphetamines are called upper speed crack, crystal, ice, shabu, or glass.
Is it true, like, if you take a lot of speed, that it creates concrete in the cranium?
Concrete?
Yeah.
I've never heard that. It's a possibility, but
Well, like, I don't know if you ever heard of mini things.
Mini?
Mini things.
Sounds like a,
Up in Montana, it was really popular for a long time, and people
sounds like
were
a grill
taking.
stuff.
Yeah, right. People were taking many things, and they called it speed. It had epinephrine and all of that in there and everything. And I even took it, and it helped me lose weight. And my uncle was telling me, don't take that because it causes concrete in the cranium.
well, I think maybe what he was talking about, remember it takes about 18 months to get over using speed or methamphetamines. You get, yeah, okay. You get meth head. So that's probably what he was talking about. You probably weren't as smart as you normally are for about 18 months. I think that's probably the concrete he was talking about. Some people never come back from it. Amphetamines are snorted. That's a good way to do it. He's using a dollar bill, but you're supposed to use a $100 bill. I don't know. Amphetamines are injected. This gets it into your system faster. Amphetamines are ingested orally, of course. Worldwide, 33 million people used amphetamines and methamphetamines in 2003. They're making a comeback. I don't know if that's good news or bad news. The Mexican cartels and the Colombian cartels are starting to cook this stuff and bring it across the border. Of course, evidently there's somebody's cooking meth pretty close to here. Not very far from here. I think I figured out where it is. I have a feeling it's down by the lake, because there's an awful lot of traffic going back and forth to the lake, even in this type of weather. Man, you can't cross that road without almost getting hit by a pickup truck. I don't know, I haven't figured it out yet. Speed used to come in several forms: amphetamines, crosstops, white crosses, and cartwheels. That's what the amphetamines are called. Black beauties or biphetamine, dexedrine are also called dexies or beans, and benzedrine, of course, is called bennies. Back in the 70s, my ex-wife, after she left me, she started pushing this stuff at a truck stop. She was a waitress to the truck drivers, theoretically to the truck drivers. And they were, the police, this is in Indiana, the police figured out what was going on, and they tried to get her to tell her who her supplier was. And instead she jumped on a bus and came back to me. I know. What a horrible thing to happen to anybody. And she came with a whole suitcase full of this stuff. It was full of marijuana and amphetamines. Of course, I was in the military at the time. I was in the middle of Lubbock, Texas. I don't know if you've ever been to Lubbock. It's in the middle of nowhere. Anyway, I threw it all away. She got pissed. She said, "You just threw away $10,000 worth of it." Well, you can't spend $10,000 from jail. That's one of the problems. I'm not cool. I've already explained to you guys that I'm not cool. I've never been cool. One of my jobs in the military was collecting drug urines on people. Mainly because I was old. I was over 21, so I could do it. If you're under 21, you're not old, you're not responsible for yourself. But I was over 21, so that was my job. Lots of people asked me to cheat, and I never did, because I figured, hell, if they're dirty, it's their own damn fault, not my fault. Just because I'm not cool isn't going to, that's no reason to put me on the line. It didn't make any sense to me. I'm not a very big guy. People used to threaten me all the time. You can see nobody ever hurt me. Amphetamines were synthesized in 1887. It was used by both sides during World War II. was used as a diet pill in the 1950s and 1960s, so it's very common to find people with amphetamines as diet pills, especially young ladies that wanted to lose weight. The hippies fueled their psychedelic experience with street speed, marijuana, and LSD. Amphetamines became a Schedule II drug in 1970. There was a reason why this happened. The war in Vietnam was going on. There was an anti-war movement in the United States. It was being fueled by the hippies. The hippies were using all of these drugs. Marijuana, of course, was against the law. LSD was not against the law at this point, and neither was amphetamines. So when they made it a Schedule II drug, one of the reasons they did it was to break up the anti-war movement so that they could arrest these guys. And that's what happened. That's exactly what happened. So it busted up the peace movement. Isn't that great? Makes a lot of sense. Street chemists began producing crank, methamphetamine sulfate, and crystal methamphetamine hydrochloride in the 1980s and 1990s. These chemists were able to convert active chemicals in cold medications. The phenylpropanamine and ephedrine and ephedrine and pseudoephedrine into crank and crystal. As good news as that is. In the 1990s, a new, stronger methamphetamine began to be produced called ice, glass, batu, or shabu. It's dextroisomer methamphetamine. This hit the, and you can see movies. They say there's a new methamphetamine on the street. We're going to call it. It's called ice, and it's going to kill all these people. It wasn't that much stronger than anything else. This form later came to be known as crystal meth, tina, peanut butter, deadhead, chalk, tweak, yellow rock, glass, rose quartz, speed. I was working in the emergency room when when ice hit the streets, and we did have a bunch of overdoses. That is true, and it's one of the reasons why I refer to it as deadhead, because it just puts concrete in your brain. It makes you stupid for like 18 months. This is the strongest stuff that we've ever found, or at least that they had found up to that point. And now, of course, we've got all the opioids on the street. We've got Disuvia, which is 1,000 times stronger than morphine. I'm so excited that we have a new drug on the street. And this one's going to kill a lot of people. How in the world do you take the right amount of something that's 1,000 times stronger than morphine? How much do you take? Yeah, exactly. That's going to be the problem. Do you take a grain of it? Do you take 3 grains? Do you take, I don't know. And I haven't seen the stuff. It's brand new, so we'll see what happens. We'll see if there's a lot more dead people. Okay. That was my job. My job was working in the emergency room. Even if they died, they came through the emergency room, and I had to check them into the morgue. That was my job. So I got to see all these people. And now we're going to see more of them because of Disuvia. It's only supposed to be in hospitals, but it's not going to take very long for somebody to decide that they can use this stuff, put it out on the street, cut it with something, maybe 1 to 10, but that still makes it stronger than fentanyl. And how much of this stuff do you take? And what did they cut it with? So many problems. The profile of the typical methamphetamine user is white male, 19 to 40. This is a really serious problem in the West. Not so much in the East, where people are a lot closer to each other. But in the West, it's a really serious problem for both men and women. So there are as many women in the West as men who are using this stuff. In the East, it's just killing men. In Cincinnati, and Cleveland, and Pittsburgh, it's just men that are overdosing. But here in the West, we have equality with our males and our females, so women die as frequently as men do. Meth is particularly rampant in the gay community, where it is the 3rd most popular drug after alcohol and marijuana. It fuels their sexual activity. Amphetamines can be cooked in laboratory facilities. Initially, biker gangs cooked the drugs, especially Hell's Angels and the Gypsy Jokers. Gypsy Jokers, Hell's Angels were primarily in the South, in Los Angeles and San Francisco. The Gypsy Jokers were in Seattle and Spokane and Pocatello, Idaho, Billings, Montana. You probably ran into the Gypsy Jokers from time to time. Never? Good, thank goodness. While I was there, there was a gunfight between the Gypsy Jokers and another biker gang in Great Falls. Yeah, it was in Great Falls. Because the Gypsy Jokers went into a bike shop and they saw some guy with somebody else's colors on, and they told him to take them off. Well, normally, you know, it's the stronger gang tells the other gang to not show their colors, and this guy wouldn't do it. Anyway, it started a gunfight. And so we've got, 15 guys on one side, 10 guys on the other side, and they're just blasting away at each other. And the cops were, just let them shoot. Just let them go. Eventually 5 people were killed on one side, 3 people were killed on the other side, and that gang did lose their colors. They did have to take their colors off. I don't understand how biker gangs work, but evidently they had to take their colors off because they lost 3 guys. Recently, Mexican gangs have taken over the manufacture of methamphetamines. The DEA estimates that there are over 300 ways to manufacture methamphetamine from pseudoephedrine, and for this reason, cold medicine has been controlled and put behind the counter. So if you have a cold and you go into to Walmart or wherever, or Bash's', they won't. You can't just pick it off the shelf. You have to ask them for it, and then it's under lock and key, because otherwise they'll just pull the stuff off the shelves. There's other ways to make this stuff. You don't need the pseudoephedrine or ephedrine. There are other ways to cook this stuff without the cold medicine. So it's called the Nazi method, the shake and bake method. It's a cool name, huh? Shake and bake. Snorting methamphetamine is more toxic to the nasal mucosa than snorting cocaine, and may cause irritation and pain, a lot more pain. Cocaine, of course, a lot of people snort cocaine, causes a lot of damage to the nasal mucosa, but methamphetamines actually is far more caustic. The most intense high comes from injecting amphetamines directly into the bloodstream. Sclerosis and pain often results from the injection, and for this reason, if you look in their antecubital area, the crook of their elbow, they'll have divots where their veins used to be. What the veins have to do is they have to recede into the body so they can't find them. The reality is you've got lots and lots of blood vessels in this portion of your arm, and these guys will just chew up all those blood vessels. If they're not careful, they'll lose the circulation to their hand and they'll lose their hand. Methamphetamine is extremely bitter and takes much longer to get the effect to the brain. Amphetamines last 4 to 6 hours as compared to the 10 to 90 minutes from cocaine. Amphetamines force the increase of neurotransmitters norepinephrine, epinephrine, and dopamine because it forces the release of these neurotransmitters from the terminal vesicles. It reverses the reabsorption pumps, forcing more neurotransmitters into the synapse. Enzymes that metabolize the neurotransmitters are blocked by amphetamines. And this person will have what seems to be a psychotic episode. They start acting psychotic. Well, of course they do. They've got all this epinephrine, norepinephrine, and dopamine in their system that is prevalent. So normally you have this stuff when good things are happening to you, or you're excited, you get these neurotransmitters. Well, this blocks the reuptake of all these neurotransmitters. So you've got an individual that's acting extremely excited, as painful and ugly as it is. Prolonged use of amphetamines reduces the body's ability to produce the affected neurotransmitters. Research shows norepinephrine reduction as long as 6 months after the drug use has ceased. But remember, norepinephrine makes you feel like you're on top of the world, like you can conquer the world. Now, all of a sudden, you're not going to have nearly as much in your system, and you don't have the drug to tell it to increase the norepinephrine level. So for 6 months, you're going to feel pretty shitty, really shitty. And it's because of the drug. Research also shows a 24% reduction of dopamine resulting in difficulty feeling pleasure. Once again, in order to have several days of high or several weeks or several months, whatever, of high, you're not going to be able to get to even feel pleasure for an extended length of time until your neurons come back. Thus, after heavy use for the individual to feel normal, they have to use the drug. And this is one of the reasons why people that use amphetamines or methamphetamines, they just have to continue using. It's the only way they can feel normal. Now, wouldn't it be easier just to not use it at all and then feel normal all the time? No, that's not nearly as much fun. We're here for a good time, right? So let's buzz out for 90 minutes, and then we'll feel bad for 6 months. That's perfect. Methamphetamine also causes the degeneration of the serotonin-producing cells, and of course, this is part of the reason that you feel good. Research of methamphetamine users found that they had an 11.3% reduction in the gray matter of their hippocampus, their cingulate gyrus, and paralimbic cortices. This is a reduction in their gray matter. The gray matter is the part that makes you smart. This is your hippocampus. This is your memory, okay? It's not as big as it used to be. You don't have the memory that you used to have. This is all good news. These areas affect your craving, your mood, your emotions, and your memory. However, grains on methamphetamines are actually larger because of they swell. And the reason that they swell is because anytime that you damage something or irritate something, it will swell up to protect itself. Well, if somebody that is on methamphetamines, that will happen naturally. The brain is trying to protect itself from you. Of course, it's not going to do any good because you're just going to keep using. Remember, you only think in one direction at a time. You can only think in one direction at a time. It's as tragic as a thing as you can possibly imagine. But people do it anyway. And they do it a lot. And they do it until all their drugs are gone. That's the way this stuff works. Amphetamines cause increased energy. It increases your heart rate. It raises your body temperature. It gives you rapid respiration. You get high blood pressure, which is always fun. It dilates your bronchial vessels, and that's why you're coughing. And it's an appetite suppression. You don't want to eat. Now, this is okay as long as you miss a meal. That's not so bad. But these people will stay up for days, and they will miss all their meals. No, they're just not hungry. You can't even feed them something. If you put a plate of food in front of this person, they'll grab something to eat, like a roll. Usually it's a roll. And they'll bite into it, and then they'll spit it out, and then they'll take off. You can't make these people eat. They're not hungry at all.
Where can you get that stuff?
Well, Travis will sell you some. Binging on amphetamines can result in not sleeping for 3 to 10 days, which is always funny when you see somebody and you ask them how long. It's like, how many beers did you drink? I had a couple. How many days have you been away? I've only been away for a couple of days. And then you get somebody else coming in and they say, no, he's been gone for 7 days. I don't think he slept for 7 days. These guys, no, he's only been awake for a couple of days. They can't. Remember, the hippocampus is going away. Tolerance of amphetamine is fairly rapid and extreme. A normal dosage is 15 to 30 milligrams. Long-term users may use as much as 5,000 milligrams a day. From 15 to 30 milligrams to 5,000. Effects on these individuals, of course, they're sleep deprived, they have heart toxicity. Even if they stop using, they may potentially have an enlarged heart. It's called cardiomyopathy, and it's usually caused by this stuff. They have blood vessel toxicity, which means their circulation is impaired and may be damaged for good. They have severe malnutrition. And of course, that causes all kinds of interesting problems. Receding gums, poor dental care is a problem. You need to drink to protect your teeth. There you go, I'm okay. Overdose may result in convulsions, hyperthermia, cardiovascular collapse. Unlike most drugs, amphetamines are abused as much or more by women than men. They may lead to use during pregnancy, which results in, this is horrible, this is really horrible. When I first started working at Children's Hospital in Omaha, it was right in the middle of the cocaine binge, where the rich people were starting to use cocaine. Well, their babies were dying, and they were being born with all kinds of horrible problems that I won't even try to describe them to you. The ones that survived, and not many of them did, this was right in the beginning. We didn't know exactly what to do with it. Cocaine had just become popular, and it had especially become popular with wealthy people. So we really didn't know what to do. These babies were coming in, and damn it, we got every damn single one of them. Because, well, the babies were fragile. So they wanted us to keep these babies alive. It was the most god-awful thing you can possibly imagine. Most of them were born with deformities. Some of the deformities were beyond anything you can possibly imagine. Hearts that were developed outside a chest. We had one baby that was born without a skull. Just god-awful stuff. Just horrible stuff. Well, what do you do with a baby with no skull? Nothing. There's nothing you can do. Anyway, if it wasn't too bad, it was things like irritable baby syndrome. The babies looked like they had autism. They were autistic. They couldn't tolerate to be touched. You had to keep them in the dark. The darker, the better. As a matter of fact, if it was completely dark, they were happy. They had tremors, all to the point of seizures, muscle coordination problems, abnormal reflexes, sucking and swallowing problems, and disturbed sleep, as if they were coming off of an addiction. Other problems that might occur for the baby born to methamphetamine user, premature delivery, which was very common, congenital deformities. And they talk about feet and their limb abnormalities, but the reality is we saw a lot of abnormalities that didn't have anything to do with the limbs. Their intestines, well, okay. Intestines protruding into their stomach was one of the minor things that we saw. Placental separation and hemorrhage being potentially lethal to both the mother and the baby. If the placenta separates from the uterine wall, then we can have, remember, this stuff is a vasoconstrictor. So it's creating a circulation problem. And because it creates a circulation problem, and because the baby is feeding off of the mother's circulation, and she has just taken this stuff, all of a sudden we'll have a constriction, and the placenta will sometimes separate from the uterine wall. And the baby will no longer, it's like a spontaneous abortion. But the problem is, of course, it causes hemorrhaging in the mother as well. As soon as she's off the stuff, and as soon as that vasoconstriction is gone, then all of a sudden she just starts gushing. She starts gushing, the baby's no longer viable because it's separated from the uterine wall. Now we got a really serious problem. To the extent that the baby's already gone, but the problem is that she may bleed to death. And we've seen that before. I was working this is when I was in the service. We had a lady that had a spontaneous abortion, and she just started bleeding like crazy. And it was my next door neighbor. And so they came over and got me, and of course, how do you stop somebody bleeding from their female parts? What do? You can't really put pressure on it, it's their guts. So what do? The only thing I could think of was to put ice on it. So we put an ice pack on her stomach. And that slowed it down enough so that we could get her to the hospital. She was hemorrhaging like crazy.
Did you give her like a pill?
Yeah, but I didn't have anything.
What kind of pill would you give them?
Vitamin K to make her clot. Yeah, but I certainly didn't have a vitamin K pill. I didn't carry them around in my pocket. So we put ice on her abdomen, which slowed down the bleeding enough so that we could transport her. I didn't go with her, and the guy that this other guy. So here I put the ice on her gut, and we've slowed down the bleeding, and this other guy came over about just before they transported her, and I had 2 kids at home, so I couldn't just take off. So he went with her, and he got a medal for saving her life. I know. Anyway, that's okay. I don't care. At least we saved her life. So this hemorrhaging is a really serious problem. Intrauterine brain hemorrhage for the child. The baby can have a stroke inside the womb. Of course, the mother is having sex with lots and lots of different people. So the probability of her picking up an STI is very probable. HIV, hepatitis B, and hepatitis C. She's shooting up with the drugs, so that's a problem. If the baby survives gestation, they may have developmental problems, growth and developmental delays, learning disabilities, increased incidence of ADHD. But is it real ADHD? I mean, the baby when it's born looks like it's autistic. The baby doesn't want to be touched. That's autism. That sounds like autism. But does the kid really have ADHD? That's a question you have to ask. Is this real ADHD? Can we treat this with Ritalin or any other amphetamine? Can we? No, we can't. Well, think about it. This kid was addicted to amphetamines when it was born. Yeah, if we give this kid amphetamines, yeah, we got a really serious problem. Increased risks of rage disorder, greater incidence of SIDS, rage disorder looks like antisocial personality disorder. I know. So this kid's potentially going to have all kinds of interesting mental health problems, and probably will end up in jail. It's kind of hard to stay away from it when you keep getting so angry that nobody can control you. Disability rates range around 33% for these kids. So there's, like I keep telling you guys, there's no good news. I got nothing here. There's no good news. You might be having a good time right now, but it's going to screw everything up for potentially the rest of somebody's life. Amphetamines produce mild, intense euphoria, alertness. It gives you sexual feelings. So some people use it as an aphrodisiac. Remember I told you that in the gay community, this was the 3rd most popular drug after alcohol and marijuana. Well, the reason is because they use it as an aphrodisiac, as exciting as all that is. It gives you a sense of well-being and confidence. After prolonged use, of course, the individual, all of these feelings slowly dissipate to some extent, so they're not getting these feelings anymore. Now they're feeling irritable, paranoid, anxious, aggressive. They may have mental confusion, poor judgment, impaired memory, and hallucinations. Remember, it's screwing with that portion of your brain, and your hippocampus has just lost 11.3% of its mass. Oh, jeez. Cingulate gyrus causes ADHD. That's where ADHD comes from. Since amphetamines cause an abundance of neurotransmitters that mimic sexual gratification, using the drug becomes a substitute for sexual activity. They feel like they just had sex when they use this stuff. So they get a sexual gratification from just taking the drug. Amphetamines will also produce violence in people prone to violence because the drug causes people to be suspicious, to be paranoid, and to be overconfident. Where does this come from? From the norepinephrine, the increase of norepinephrine. This proclivity for violence among meth users can lead to child abuse and neglect. In Oregon in 2004, 1,850 meth labs were busted, and a full 80% of the child abuse and neglect cases involve meth users. Now, I keep telling you that they can only think in one direction at a time. This is not good news, because these individuals, if you try to take their child away, now all of a sudden they're thinking about how much they love their child. And they will swear on a stack of Bibles that it'll never happen again, and if you take this child away from them, they're going to commit suicide or they're going to come and kill you. That's fun. They only think in one direction at a time. Now, the best thing for this kid is to get away from this crazy person. But it's really hard to take a kid away from a parent. It's difficult. It's extremely difficult. Even this guy, even this individual, that guy, the guy in Albuquerque, he was prostituting his daughter for 3 years. She's 7 years old today. He started prostituting her when she was 5. And the reason he had her was because he was so adamant about wanting her. He didn't want her so that she could become a prostitute. He wanted her because, remember, he only thinks in one can only think in one direction at a time. He's not thinking of her welfare. He's thinking about how much he loves her, how much he wants her. But then, when it comes time for his next fix, and he doesn't have any money, what's he going to do? Remember, he can only think in one direction at a time. He can only put his brain on one thing at a time. He wants that fix. So now his daughter is not even in his mind. She's just a commodity as far as he's concerned. And this is the problem. This is why we see so much neglect and child abuse. Because they can only think about one thing at a time. They can't think about consequences. That's thinking in two different directions. If I do this, this is going to happen. If I don't do this, this is going to happen. That's two different thoughts. They can't think like that. They can only think, I need this. If I use this, I'll feel better. That's it. Not what's going to happen to my daughter if she gets raped by somebody. Excessive amphetamine usage can lead to amphetamine psychosis. Just as with cocaine, they have hallucinations, loss of contact with reality, speech patterns that are indistinguishable from paranoid schizophrenia. These are not fun people, especially when they're high. They're not very much fun at all. And this is one of the reasons why people don't want to be around them. That and the fact that they're violent. And they can't control their violent behavior because they can only think in one direction at a time. Since these symptoms are caused by excess dopamine released by the drug, psychotic episodes can be induced at fairly low doses in individuals prone to excess dopamine. If they have too many dopamine receptor sites. We know that people who are schizophrenic have too many dopamine receptor sites, the D2 sites. They have too many of these things. So if they start using amphetamines or they use something that increases their dopamine, they're going to have a psychotic episode. And this is one of the reasons why marijuana is so dangerous. Marijuana increases your dopamine. So a lot of individuals who have never had a psychotic episode before, they smoke marijuana despite the fact that it's supposed to make you mellow, and they are kicked into a psychotic episode and they never come back. They will be schizophrenic for the rest of their lives. Same thing happens with this stuff, except this stuff is more it's synthetic. It's a simulated psychosis. And they'll bounce back and forth between psychosis when they use and being normal, and then eventually they don't come back anymore. And they're gone.
I know someone like that. I know someone that was like, they were like a straight A student in high school, and he was really smart, and he smelled, I guess he smelled gas a lot, and he just, he's schizophrenic, he's just like gone, talks to himself all the time, sees people, it's crazy.
Crazy.
And this guy was like he was an A student, honor roll student, I guess is what you say.
I was teaching in Nebraska, teaching high school in Nebraska. I had these two brilliant students, brother and sister. One was a senior, the other was a freshman. And he went off to college and started using speed in order to get all this work done. Well, he was gone. He was psychotic. They put him in a mental hospital. So when his sister went off to college, she did exactly the same thing. Both of them, smartest kids in the smartest whips. Really nice people. When they were using, oh my God, you couldn't be anywhere close to them. They were whacked out. Anyway, they never came back. Too much fun. Some individuals may have immediate psychosis, and that's what happened. With these two individuals, first time they used, they were gone. They were psychotic. And other individuals may use for years, and then all of a sudden, they'll just pop right into psychosis, like my friend did, or my student. She was my student. She thought,
And you can't argue with the person who like smokes marijuana intensely, you know, because they say, oh, marijuana, it's not bad for you.
it's organic.
Yeah, it doesn't cause any kind of violence or anything, you know, and they just think it's like the best thing in the whole world, you know. And
It's a medication.
Yeah.
It stops seizures. It makes you not throw up.
yeah, and like they're coming out with like these bath fizzes that have that THC oil or something in it.
Oh, CBD oil?
Yeah, I don't know about that though. Is that
It works.
Yeah, CBD oil.
oh really?
Like for broken bones or if you injure yourself. I tried it for my wrist, it was hurting.
Did you
Put
get
it on
stoned?
there. Stoned.
Was you?
No, you.
Was you?
No,
really?
it just
No.
numbed it. I couldn't
Oh.
feel it.
Oh, really?
Yeah. it
Well, that's not
works.
good.
Well, it didn't really numb it. I just couldn't feel the pain.
Well, the CBD
Where
oil,
did you get it?
it's not a hallucinogen. It's a THC.
Farmington and Durango.
I told you, if you want amphetamines, ask Travis.
No drug dealer.
Wow. Crystal meth, CBD oil is the substance in marijuana that takes away the nausea, that affects the pain. It's not a hallucinogen. It's THC is the hallucinogen. So when we're talking about marijuana, a lot of people are saying, well, it helped my kid not have seizures. Well, it was the CBD oil that worked on the seizures. It wasn't the THC.
CBD?
CBD.
CBD?
CBD oil. Yeah. So we're talking about two completely different things. One comes from the other. Not only that, but most marijuana is grown to increase the THC level so you get higher. The higher the THC, the lower the CBD oil. But you can grow marijuana and produce a lot of CBD and only a little bit of THC. Or you can grow a plant that has a lot of both. But the problem, the thing is, people are talking about smoking pot and having, a positive reaction to it. But it's the CBD oil that gives you the positive reaction. So potentially we could separate the CBD oil from the THC, and we could use the CBD oil as a medication. So that's where the medical marijuana argument comes in. So the people that are claiming that they have to smoke the pot in order to.
Did you know that in traditional culture we use that marijuana plant? We use it for.
It's from China.
We use it for. We must have.
It didn't come over here until the 1700s.
I don't know. Well, actually, we have it almost similar.
No, you don't.
It's called. I don't know the.
Are you talking about
scientific name.
mountain tobacco or
No,
Connecticut?
it's a different plant. It's almost the same as marijuana. We call it the big leaf plant, chochilier, we call it, and it has
Okay.
a lot of that CBD oil.
Yeah.
So you would use it for like a horse that broke its leg. We use it on horses and animals,
Okay.
and then it can be put on an individual like with broken bones, like if somebody that breaks something really bad.
What does this plant look like?
It grows in like those ditches. It has a big leaf. It's almost similar to poison ivy, but it's a little different. It's in that same category.
Sure.
Is it like one of those, is it like one of those plants that are like white, like lilies?
Yeah, the white tips. Yeah, and they call it chochille. And that thing can drive you nuts. It's almost like marijuana.
Oh, is that right?
It's a little stronger than marijuana.
THC?
You see some like during the summer around the canyons.
Yeah,
So it's a white tip plant?
yeah.
Really?
I'll get the scientific name.
Okay. Yeah, it may be a member of the nightshade family. Yeah, because it has properties as well.
Why do we have traditional stories about this marijuana plant? If
You don't?
it's called a five-finger plant. Balashlai.
You
We
should.
call it the five-finger plant. And we have stories to where a white shell woman, she created these herbs and she planted them in separate areas. Like in the mountain, there's the mountain group
Right.
plants, and then the valley plants, and then the ones that grow by the big ocean waters. And she planted, and then peyote's in there.
Sure.
So
But it comes
and then marijuana's in there.
Right. It
And
comes from South America and Central America.
there's 5 different types of herbs that we call it the medicine for the five-fingered human beings. And the only way to treat people that are addicted to these, like marijuana, is to use the
Right.
same group to treat them. So that's the only way they can get over their mental illness.
If
So,
you're-
or their addiction.
Right. If you're talking about a plant, you're not talking about marijuana, because marijuana was never here, not until.
But they
Washington.
say the Navajos came from the Bering Strait, you know, so that's kind of like close in that vicinity.
That's a possibility, but it wasn't here. That's the problem. It came here with when they started growing hemp back east, and then when they started transporting the hemp, that's when it got into the ditches. So you're talking about the 1850s. You know, you're probably talking about another plant, and people have assumed that it was marijuana. That's probably what's going on, because you have a name, and this is a medicinal plant, and this medicinal plant just moved into where that other plant was.
I think that might happen.
Yeah.
That's a really good research to do.
Yeah, I
Maybe I
don't.
can do a paper on that at the end of the
Sure,
season.
why not? Sure. Good luck. Because now everything's got mixed together. So when you say, use the word that you used, people are thinking it's marijuana, and since that's the only one that's around, or since they don't know what the other plant looked like, they assume that it was marijuana, but it can't possibly be marijuana, because it didn't come over here until the 1700s. It's like pheasants. You know, pheasants are a Chinese bird, and it didn't come over here until the crazy Brits decided they wanted to hunt them. So they brought them over, the pheasants. Red foxes the same way. Starlings are the same way. English sparrows, geez, those damn Brits, they just kept screwing up everything. Bringing things over to make the United States look like what they had overseas. Yeah, that would be an interesting research. Crystal meth seems to have the strongest effect on the brain chemistry, and since it has fewer cardiovascular effects, can be smoked in larger quantities. The result is more severe paranoia, hallucinations, hypervigilant thinking. Remember, these people can only think in one direction at a time. So if they're focused on somebody trying to hurt them, that's all they're going to be able to think about. Suicidal depression is another problem, and addictive use. Of course, suicidal depression, once you get to the point of wanting to commit suicide, you want to come out of it, and the only way to come out of it is to start using again. So they don't stay away from it. ADHD is caused by a depletion of dopamine. Amphetamines are used to treat ADHD because they increase dopamine and block its metabolism. Methylphenidate or Ritalin, about 10 million prescriptions per year are written for Ritalin. Adderall, D-amphetamine, about 7.7 million prescriptions per year. Strattera, atomoxetine, about 5.8 million prescriptions per year. And Pimeline Siler, of course, is the newest of the amphetamines used to treat ADHD. Amphetamines work on ADHD 75% of the time, which means we're diagnosing a lot of people that really don't have ADHD. They have, it's an environmental problem or whatever, and so they're not going to respond to this stuff because they really don't have ADHD. They have just been diagnosed with ADHD. And now they're starting to publish the fact that Prozac, Zoloft, Paxil only works about 2/3 of the time. It only works on about 67% of the people that take it, which means that 33% it doesn't work on of the people that are taking it. So if you've ever been depressed and they threw some Prozac at you and it didn't seem to work, you may be one of those 1/3. Research shows that children taking amphetamine therapy for ADHD in the long term have an increased risk of alcohol and drug abuse as adults. And this is one of the reasons why this kid that was addicted to amphetamines when he was born, we really can't give him any of this stuff. My great nephew, who was addicted to heroin when he was born, we can't give him anything. Even though he's going to have these symptoms, he's going to look like he has ADHD, but they can't give him anything. If they do, he's going to become addicted to it. This kid will have an addictive personality all of his life. He'll become a chain smoker. He'll become a gambler. Maybe it'll have something to do with sex. Who knows what's going to happen with this kid? But people need to keep an eye on him because he is anything. He can become obsessed with just about anything, as sad as that is. And he's my great-great-nephew.
FAS kids are children are like that too,
Yeah.
right?
Yeah, they have to stay away from everything. Not just alcohol, but anything. Half the children with ADHD have comorbid ODD, oppositional defiant disorder. If left untreated, these individuals are more likely to progress to more serious problems, stealing, vandalism, and arson. Arson, of course, leads to antisocial personality disorder. And of course, these individuals very often will end up in jail because they can't help themselves. One of the main uses for amphetamines throughout the 20th century was as a diet pill, but every time a new drug hit the market, it seemed to cause its own set of problems. One such problem came with the two amphetamines, phentermine and fenfluramine, marketed as fen-phen. And you were supposed to take these two amphetamines at the same time.
I remember that.
Yeah, it killed a lot of women. Given in tandem, the drug caused heart valve damage in select women. In 1999, the drugs were taken off the market. They're back on the market, that's the good news. So you can take fen-phen now, but they will check you to make sure that you don't have that heart valve problem and it won't kill you. I know, this is all good news, isn't it? My wife took fen-phen for a while. When my wife was in the service, my wife is short and squat. She's got little bitty short arms. She's kind of interesting. But so she had a hard time making weight. I mean, the Air Force wants you to be tall and skinny, and she's not tall and she's not skinny. She's full-bodied. So the poor thing was on a diet like for the entire 24 years she was in the service. She's always trying to lose weight. Fen-phen was just one of the things that she tried, and it worked. What worked the best was a POW diet where she ate brown rice and fish for every meal. Oh my God. I hated that. I hate fish. I just hate the smell of fish. Anyway, stimulants are and have been used all over the world for centuries. In the Middle East, they chew khat. In the Far East, they chew betel nuts. I've been to Egypt, where they chew a lot of khat. I've been to Southeast Asia, where they chew a lot of betel nuts and turns their teeth black, which is always attractive, people with black teeth. In Africa, they strip the bark off of this one tree, the himbe tree, and they chew the bark, and it gives them a high. Ephedra, of course, is in the Mediterranean area. It's actually here, it's everywhere. So there's ephedra plants all over the place. So out in the desert, you can, you can figure out how to process it. Khat is a mild stimulant found in the Middle East. Smuggling of this drug in the United States has become more prevalent as more and more immigrants from the area come into the United States. The key stimulant in the leaf is cathinone, which evaporates if the leaf isn't used within 48 hours after harvesting. So you've got 48 hours to get a buzz off this stuff. And it only grows over in the Great Horn of Africa. So you have to transport it from there to the United States within 48 hours for it to work. This substance is said to produce an effect between caffeine and methamphetamines. Methcathinone is a synthetic version of cathinone. When I was over in Egypt, our drivers used this stuff. And sometimes they would just blast right through camp, so we were never sure. And they were driving all over the place. If you've ever been out in the desert out there, there are roads, but sometimes you can drive off the road and it's just the same as being on the road. Anyway, these guys are all over the place and they're coming toward camp, and you never knew if they were going to stop or if they weren't. The first time and everybody said, here they come, get out of the way, get out of the way. So I followed this other guy, and we went completely out of the camp, and they just came blasting through the camp. They ran through some of the tents, and they stopped like 100 feet on the other side of the camp. It was not funny. If anybody had been in any of those tents, they would have killed them. And one of them was the medical tent, which was my tent, and they had screwed up all this equipment. Anyway, not important. And of course they didn't speak English, so we were yelling at them in Egyptian, and we didn't know that much Egyptian. It was kind of funny. This drug is used extensively in the Horn of Africa and on the Arabian Peninsula. In Yemen, half the population uses khat, and a family may spend 1/3 of their income on this drug. This drug is a driving force in the economies of many of the countries in the area. The drug is used socially. So if you go to somebody's house, they'll give you a khat leaf to chew. In some places, if you don't chew it, then it's an insult, and you can get punched in the face or killed. So, we all have to get stoned in order for you to be socially acceptable. Chronic khat use can cause physical exhaustion and suicidal depression when you withdraw the drug, and of course, that was one of the reasons that a lot of people from this area didn't want to immigrate to the United States, because they were hung up on this stuff. Synthetic cathinone is known as methcathinone. While this is only found sparingly in the United States, it is much more common in Europe, and in fact represents 20% of the illicit drug use in the Russian Republic. This is not good news, because these guys are on something different than what we are in the United States. So it gives them a different mentality. Methcathinone is much more intense than khat, and is used as an additive as methamphetamine. With this drug, there is more dopamine reduction, and so Parkinsonism is more common. In other words, the tremors. So when they get off the stuff, they can't stop shaking. They are fairly non-functional. Betel nut comes from the betel nut palm and are found all over southern Asia. It is used extensively in India, Pakistan, the Arab world, Taiwan, Malaysia, the Philippines, New Guinea, Polynesia, southern China, and Africa. So if you go to that area of the world, not China of course, but if you go to Taiwan or any place in South Asia, the southern area of Asia, you're going to run into this stuff. It's red. It's like cherry juice. It looks like cherry juice, but if you chew enough of it, your teeth actually turn black. They turn so red that they look black. Worldwide, between 200 and 450 million people use this substance all the time. We ran into it all the time in Vietnam. Ask your dad about it. The women You know, there's some old lady sitting there, and you know, she starts smiling at you, and she's got these black teeth going, oh, not attractive. And so her daughter's sitting right beside her. She's like 20 years old, and she opens her mouth, and her teeth are red, all red. They look like she's bleeding. It's not the most attractive thing in the world. In Taiwan, 17% of the men and 1% of the women use betel nut. One recent controversy in Taiwan is the betel nut beauties who man betel nut kiosks while dressed provocatively to attract male customers. You think I'm kidding? This is a really serious problem. China is fairly conservative, and when these women are wandering around in their underwear, it's very offensive to a lot of different people. These kiosks are right in the middle of the road. It's like a coffee kiosk or a toll booth. That's what they look like. And these women will sell these betel nuts right out of the kiosk. The less clothes they wear, the more sales they make. And this has become very controversial on Taiwan. Some authorities are demanding more modesty for fear of compromising public morals. They're not prostitutes, usually, but they certainly are partially naked, as weird as that seems. Like I said, the Chinese are very conservative, relatively conservative people. They're very collectivistic. So if one person dresses differently from somebody else, it causes a really huge stir in that area. I picked a picture that was less offensive. There are more offensive pictures I could have picked, but of course I didn't want to offend anyone in the room with somebody's nakedness. This is what their teeth look like. Always attractive. Black teeth are always attractive. The active ingredient in betel nut is paracholine, which induces an increase of epinephrine and norepinephrine in the central nervous system. This causes a mild euphoria, excitation, and a decrease of fatigue. The juice of the nut is dark red and stains the mouth red to black. Of course, the longer you've been chewing, the blacker your teeth are. You think I'm kidding. This is not a lot of fun. You know, some lady's flirting with you, and she flashes a black-toothed smile. It's really quite attractive. Paracholine and muscarine are fairly toxic and cause mouth and esophagus irritation that might lead to cancer in the area. 7% of chronic users develop the cancer. In India, betel nut is mixed with sweetened tobacco to make a product known as gutka. So that's what they chew in. They actually chew tobacco in India more than they smoke tobacco. So they mix it with betel nut, the paracholine, and they get a substance called gutka. Let's see. Okay, why don't we stop right here? We'll pick this up next time. We'll talk about yohimbine. Turns out yohimbine is a sexual stimulant. Oh my God.